Did you know that brain tumors can develop silently, with symptoms that often go unnoticed for months or even years? Many people mistake the early warning signs for stress, migraines, or simply aging, when in reality, these could be serious red flags. Ignoring them can delay diagnosis and treatment, making the condition harder to manage. That's why recognizing the symptoms early is critical, and in this video, we'll reveal 9 warning signs of a brain tumor that you should never ignore. A brain tumor is an abnormal growth of cells in the brain. Some are benign, non-cancerous, and grow slowly, while others are malignant, cancerous, and can spread aggressively, affecting brain function. These tumors may originate in the brain or spread from cancer in other parts of the body, metastatic tumors. Certain risk factors increase the likelihood of developing a brain tumor, including family history, radiation exposure, weakened immune system, and exposure to harmful chemicals. Recognizing the symptoms early could save your life, so let's dive into the 9 key warning signs you need to watch for. Number 1. Persistent and severe headaches. Headaches are common, and most of the time, they're nothing to worry about. But when a headache is persistent, unusually severe, and doesn't respond to normal pain relief, it could be a sign of something more serious, like a brain tumor. Tumors put pressure on the brain, causing chronic headaches that often feel different from regular migraines or tension headaches. One key warning sign is when the headache is worse in the morning or when you're lying down, as this could indicate increased pressure inside the skull. Unlike typical headaches that improve with rest or over-the-counter painkillers, brain tumor-related headaches tend to get worse over time and don't go away with medication. Another red flag is if the headache is accompanied by nausea, vomiting, vision problems, or cognitive changes like difficulty concentrating or memory issues. These additional symptoms suggest the tumor may be affecting other areas of brain function. While headaches are often misdiagnosed as migraines, sinus infections, or stress-related tension headaches, if you experience persistent, unexplained headaches that don't follow your usual pattern, it's important to consult a doctor. Early detection can make a huge difference, so never ignore headaches that feel unusual, intense, or progressively worsening. Number 2. Speech and vision problems. Speech and vision problems can sometimes be brushed off as fatigue, aging, or stress, but when these issues become persistent or worsen over time, they could indicate something far more serious, like a brain tumor. Since different parts of the brain control speech and vision, a tumor growing in these areas can interfere with communication and how you process what you see. Speech difficulties may include slurred speech, trouble forming words, or difficulty expressing thoughts. You might find yourself searching for the right words more often or struggling to understand conversations that once felt effortless. These symptoms can be subtle at first, making it easy to dismiss them as stress or simple forgetfulness. Vision problems are another major warning sign. A tumor can put pressure on the optic nerve or visual processing centers, leading to blurry vision, double vision, loss of peripheral vision, uncontrolled eye movements, or increased sensitivity to light. Some people even experience sudden episodes of partial or complete vision loss. Because these symptoms can also be caused by strokes, neurological disorders, or migraines, they are often misdiagnosed. If you experience ongoing speech or vision issues without a clear explanation, it's essential to seek medical advice as soon as possible. Early detection could be life-saving. Number 3. Focal deficit, muscle weakness or paralysis in specific areas. Muscle weakness or sudden paralysis in specific areas of the body is a serious symptom that should never be ignored. When a brain tumor develops in or near the motor cortex, the part of the brain responsible for movement, it can disrupt the brain's ability to send signals to different muscle groups. This can result in focal deficits, meaning weakness, numbness, or loss of function in a specific part of the body, often on just one side. People with a tumor affecting motor function may experience trouble lifting objects, difficulty walking, or even losing coordination in their hands or legs. Simple tasks like buttoning a shirt, holding a cup, or climbing stairs may suddenly feel more challenging. Over time, these symptoms can worsen, leading to partial paralysis or difficulty controlling movements. Because focal deficits resemble symptoms of strokes, multiple sclerosis, or nerve damage, they are often misdiagnosed. However, if weakness or numbness gradually worsens over time or is accompanied by other neurological symptoms, such as headaches or vision changes, it's critical to seek medical attention. The earlier a brain tumor is detected, the better the chances of effective treatment and improved quality of life. Number 4. Nausea, vomiting, and dizziness. Nausea, vomiting, and dizziness are common symptoms that people often associate with minor illnesses like food poisoning, the flu, or vertigo. However, when these symptoms become persistent, unexplained, and unrelated to food intake, they could be a warning sign of a brain tumor, especially if they don't improve with typical treatments. A brain tumor can affect the brainstem or areas responsible for balance and coordination, leading to frequent nausea, sudden vomiting, and dizziness that seems to come out of nowhere. Unlike food poisoning or the stomach flu, tumor-related nausea doesn't usually accompany other digestive issues like diarrhea or stomach cramps. Instead, it may be triggered by changes in head position, increased pressure inside the skull, or the tumor interfering with signals between the brain and body. Dizziness and loss of balance are also key signs. Some people may feel lightheaded, unsteady when walking, or even experience sudden falls without a clear cause. These symptoms can often be mistaken for inner ear disorders, dehydration, or vertigo, but when they persist or worsen over time, they should be taken seriously. If you or someone you know experiences ongoing nausea, vomiting, or dizziness without a clear explanation, consulting a doctor is essential for early diagnosis and treatment. Number 5. Unexplained muscle weakness and fatigue. Feeling tired after a long day is normal, but persistent muscle weakness and extreme fatigue, even after getting enough rest, could be a sign of something more serious, like a brain tumor. When a tumor interferes with nerve signals between the brain and muscles, it can lead to a gradual loss of strength and unexplained exhaustion that doesn't go away with sleep or rest. People experiencing this symptom may find simple daily tasks suddenly becoming more difficult. Walking up the stairs feels like a challenge, lifting objects takes more effort, or even standing for long periods becomes exhausting. Unlike general tiredness, this kind of fatigue is often disproportionate to activity levels, meaning even small movements can leave a person feeling drained. This symptom is commonly mistaken for chronic fatigue syndrome, anemia, thyroid disorders, or autoimmune diseases, leading to delays in diagnosis. However, if muscle weakness and fatigue appear gradually, worsen over time, or are accompanied by other neurological symptoms like headaches or dizziness, it's important to see a doctor. Early detection of a brain tumor can significantly improve treatment outcomes, so don't ignore persistent, unexplained fatigue. Your body could be signaling something serious. Number 6. Sleeping issues, insomnia or excessive sleepiness. Sleep is essential for overall health, but when you experience persistent sleep disturbances without a clear reason, it could be a sign of something deeper, like a brain tumor. Tumors located near the hypothalamus or brainstem can disrupt the body's natural sleep-wake cycle, leading to severe insomnia or excessive daytime sleepiness. Some people may struggle with falling asleep or staying asleep, even when they feel exhausted. Others may experience the opposite effect, feeling unusually drowsy throughout the day despite getting a full night's rest. In some cases, frequent nightmares, restless sleep, or sudden episodes of confusion upon waking may also occur. These disruptions happen because the tumor affects the brain's ability to regulate sleep hormones and control normal sleep patterns. Since sleep problems are often linked to stress, depression, or sleep apnea, many people don't associate them with neurological issues. However, if sleep disturbances appear suddenly, persist for weeks, or are accompanied by other symptoms like headaches, dizziness, or personality changes, it's crucial to consult a doctor. Ignoring persistent sleep problems could delay the diagnosis of a serious condition, including brain tumors. Number 7. Personality, mood, and behavioral changes. Personality, mood, and behavioral changes can be some of the most overlooked signs of a brain tumor because they often mimic common mental health conditions like depression, anxiety, or bipolar disorder. However, when these changes appear suddenly, become more severe, or occur alongside other neurological symptoms, they could indicate a tumor affecting the frontal lobe or limbic system, the areas of the brain responsible for emotions, decision-making, and social behavior. People with a brain tumor in these regions may experience sudden mood swings, increased irritability, or unexplained aggression. Some may develop symptoms of depression or anxiety seemingly out of nowhere, while others may show a complete lack of emotion or motivation, even in situations that would typically cause a reaction. In some cases, individuals may withdraw from social interactions, avoid loved ones, or struggle with impulsive behavior they never had before. Because these symptoms resemble mental health disorders, they are often misdiagnosed. However, if personality changes occur alongside headaches, confusion, memory issues, or trouble concentrating, it's crucial to seek medical attention. Changes in personality aren't just psychological, they could be a sign of something physically affecting the brain. Number 8. Numbness or tingling sensations. Experiencing numbness, tingling, or a burning sensation in your hands, feet, or face can sometimes be attributed to temporary issues like sleeping in an awkward position or poor circulation. However, when these sensations persist, worsen, or occur without a clear cause, they could be a sign of something far more serious, like a brain tumor. Brain tumors can press on sensory nerves or disrupt the brain's ability to process touch and temperature, leading to unexplained numbness, tingling, or a pins and needles sensation. Depending on the tumor's location, some people may experience these sensations on just one side of the body, while others might feel them in specific regions like the face, arms, or legs. Because numbness and tingling are commonly linked to nerve damage, diabetes-related neuropathy, or poor circulation, this symptom is often overlooked or misdiagnosed. However, if the sensation gradually worsens, spreads, or occurs alongside other neurological signs, such as weakness, balance issues, or vision problems, it's essential to consult a doctor. Ignoring persistent numbness could delay the diagnosis of a serious condition, including brain tumors. Number 9. Seizures. Seizures can be a frightening and unexpected symptom of a brain tumor, as they occur when the tumor disrupts normal electrical activity in the brain. Unlike epilepsy, where seizures are often a lifelong condition, a seizure caused by a brain tumor may develop suddenly in someone with no prior history of seizures. This is often one of the earliest warning signs of a tumor, even before other symptoms appear. Tumor-related seizures can manifest in different ways. Some people experience uncontrollable muscle jerking, twitching, or convulsions, while others may have blank staring episodes or brief lapses in awareness. In some cases, a seizure may cause sudden confusion, strange sensory experiences, or even hallucinations. These symptoms can last for seconds to minutes and may leave a person feeling disoriented afterward. Because seizures can also be caused by epilepsy, head injuries, or metabolic disorders, they are often misdiagnosed, delaying proper treatment. However, if you or someone you know experiences a first-time seizure with no prior history, especially when paired with other neurological symptoms like headaches or personality changes. It's essential to see a doctor immediately. Early diagnosis can be life-saving. How are brain tumors diagnosed? Diagnosing a brain tumor involves multiple steps, as many of its symptoms overlap with other neurological conditions. To determine whether a tumor is present, doctors use a combination of clinical assessments and imaging techniques. Neurological exams. The first step in diagnosis involves testing reflexes, muscle strength, balance, coordination, vision, and memory to assess how well the brain is functioning. Changes in these areas can indicate potential pressure or damage from a tumor. MRI and CT scans, magnetic resonance imaging, MRI, and computed tomography, CT, scans provide detailed images of the brain, helping doctors locate the tumor, determine its size, and evaluate whether it is affecting surrounding tissues. MRI scans are preferred for detecting tumors due to their high-resolution images. Biopsy and lumbar puncture. If a tumor is detected, a biopsy may be performed, where a small sample of the tumor is removed and examined under a microscope to determine whether it is benign, non-cancerous, or malignant, cancerous. In some cases, a lumbar puncture, spinal tap, is used to analyze cerebrospinal fluid for cancer cells. Treatment options for brain tumors. Treatment for brain tumors depends on factors such as tumor type, size, location, and whether it is cancerous or not. The goal is to remove or control the tumor while preserving brain function. Surgery. If the tumor is accessible, a neurosurgeon may remove as much of it as possible without damaging surrounding brain tissue. In some cases, complete removal is not possible, and surgery is combined with other treatments. Radiation therapy. This treatment uses high-energy rays to target and destroy tumor cells. It's often used after surgery to eliminate remaining cancer cells or as the main treatment if surgery is not an option. Chemotherapy. Powerful drugs are used to kill rapidly growing cancer cells. It is typically given orally or through an IV, and may be combined with radiation therapy. However, chemotherapy is often more effective for certain types of brain tumors than others. Targeted therapy. This advanced treatment attacks specific genetic mutations within the tumor, helping to slow its growth while minimizing damage to healthy brain tissue. Ongoing research continues to improve targeted therapies, offering new hope for patients with aggressive tumors. Early detection and the right treatment plan can significantly improve outcomes for brain tumor patients. If you or a loved one are experiencing persistent symptoms, seeking medical attention sooner rather than later can be life-saving. Brain tumors are serious, but early detection can make all the difference. Many of the symptoms we discussed, headaches, vision changes, muscle weakness, or personality shifts, can be easy to dismiss. However, if these signs persist or worsen, it's crucial to seek medical attention immediately. The sooner a brain tumor is diagnosed, the better the chances of successful treatment and recovery. If you found this video helpful, please share it with your friends and family to help raise awareness. You never know who might need this life-saving information. Don't forget to subscribe to our channel for more health-related content, so you stay informed about important medical topics. Your health matters, and knowledge is your best defense. Thanks for watching, and take care.